So step 5 of our process is plan. Now, this is the area that most physios fall down in. We do a really good interview, we find out what their problem is, we do some treatment that helps, we give really good exercises, stretches, recommendations and advice, and then we don't tell them what to do next. So the way that I like to think about the plan process is, it's like your favourite TV show. So you're watching your favourite TV show, it comes to an end, and it says, on the next episode, this is what's going to happen. And it keeps you hooked. So if you've had a really good consultation with someone, what you need to do is give them a plan. So a plan's going to come back to the 4 main questions that they asked at the start of the consultation that the patient wants to know, which is what's wrong, can you help me, what do I have to do to help myself, how long is it going to take to get better. So your plan's going to involve telling them what the diagnosis is, telling them approximately how long it's going to take to get better, and the way I like to break it up is a mild condition, 2 to 4 treatments, 2 weeks, a moderate condition, which could be anywhere from 4 to 10 treatments over 6 weeks, and then a more severe or a more chronic condition which needs more than 10 treatments and it's going to take more than 6 weeks. It could be anywhere up to a year depending on the condition. So most patients don't want to know the exact number of days till their problem gets better. They want to know a ballpark. Is it going to take a week, a month or a year? It's really good to let them know that. And the thing is, I generally say to my patients, well, based on what I've found today and people I've treated in the past with a similar condition to you, your condition generally takes around a month to get better, but it's going to depend on your circumstances. You know, do you have to keep putting your back in a position that irritates it, like sitting all day at work or bending over all the time in your job? And can you do all the things that help it? How often are you going to do the exercises? Are you going to take the right medications at the start? So there's a lot of influences on someone's recovery. So you can really frame it in a way that puts a lot of the onus back on the patient. One thing that you want to do is you want to be quite firm in your recommendations and say, well, okay, it's going to get better as quickly as possible if you do all the things that we've discussed today. But I think we tend to be a bit soft and not hold our patients accountable enough and say, oh, well, okay, it's going to get better on its own, or this may help. Yeah, you want to give firm recommendations and use power language, which is not beating around the bush and giving recommendations that are clear, not using a lot of medical jargon or medical speak, especially if your patient can't necessarily understand it, and giving a firm recommendation. So as your physio, I'd recommend that you have 2 treatments a week for the next 2 weeks. And then if it's getting better, we can see you weekly for the next couple of weeks, because I think it's going to take about 4 weeks for you to get better. So when you give a recommendation, that's got to include your ability to help the patient too. So going back to what I said about your favourite TV show. So the next time I see you, we're going to check out your knee or we're going to check out your back. We're going to see what worked, and we're going to work out how to get you back to doing the thing that you told me in the interview that you want to be able to do. So the thing that's most important to you. So if you can say to the patient those 4 things: what's wrong? This is what it is. Can you help me? Yes, physio can help you. How long is it going to take to get better? It's either your mild, moderate, or your severe or chronic condition. What can you do to help yourself? These are the recommendations. So you want to focus now at the end of the consultation on the thing that's most important to them, and they've told that to you in the initial interview. They've said, okay, well, I want to get better so I can do this. I pick up my kids, get a full night's sleep. So I generally end by saying, okay, well, if you can book in for your next consultations with me, speak to reception, and we're going to get you back up and running so you can get a full night's sleep, so you can pick up your kids. That's how I like to end things. So that's step 5, which is the plan. So that's my version of the perfect consultation, guys. So yeah, I look forward to presenting you with some great material around these topics and more topics around giving really good consultations, giving really good patient care, and just giving you more of my experience that I've had in my clinic. So thanks for listening.